Okay, Liz says, I have horrible menstrual cycles. Birth control doesn't work. Is there any type of surgery to get rid of your menstrual cycles? Definitely, there are. There's lots of options. One non-surgical option, just to mention, is that the progesterone IUDs for a lot of people do the job. So non-surgical option and non-permanent, in case you decide that you want more kids in the future, all the surgical options for heavy periods are permanent and pretty much means you can't have kids in the future. So you're either thinking about an endometrial ablation, which is like the NovaSure or the hydrothermoablation HTA. Those are the main two that we do. Those are permanent, and they will reduce heavy menstrual bleeding in about 85% of patients. About half those patients will have no period, and about half of those patients will have a light period. It's not birth control. You have to have undergone sterilization, or your partner has to have undergone sterilization. In an ideal world, we would encourage the man to have a vasectomy because there is a risk if you've had a tubal and then you have an ablation of this thing called post-ablation syndrome, and it's a very painful condition where you might not have a period anymore, but every month you're having pain, and it's basically because the blood can't get out, and so you have this horrible cramps every month, and you might not have a period anymore, but the pain's unbelievable, and it's often a cause for hysterectomy. And then, of course, hysterectomy is the other surgical treatment for heavy menstrual periods. Obviously permanent, can't undo it, can't have babies after that. But the good thing about it is, if you take that step, you can guarantee that's the end of your periods forever and ever, amen. And if you're curious, I just put a video up last week that shows a couple of examples of some robotic surgery where I did hysterectomies, most commonly with like endometriosis for hysterectomy, or if you've had a bunch of prior C-sections or other complicated pelvic surgery in the past. Those are the kind of things that would possibly necessitate that type of surgery. But there's a video up. It's kind of cool. You can see the robot. You can see me working. You can see the robot working. You can see inside the patient. You can see what I see on the robot. It's a pretty cool video. So if you haven't seen it yet, you might check that out.